We're now joined by Professor Mohlopheni Jackson Marakalala of the Africa Health Research Institute, and he joins us now via our video link. Professor, thank you so much for your time this evening here on SABC News. I mean, one would say we do understand that, you held a conference, the 8th TB conference, with the title Accelerating Progress to End Tuberculosis. Perhaps let's start off there. Let's start off our conversation with that conference. So how did that go?
Good evening to you and the listeners. Yes, so the conference was actually well received. It focused largely on challenges that we still experience with combating TB that we know is still actually a major public health challenge. So the conference addressed 4 major areas, including clinical basis of the disease and solutions that could improve treatment, as we were just talking about, particularly on drug-resistant strains of TB, as well as actually social determinants such as housing and engagement by government to address social determinants that actually make TB difficult to deal with. And there were also other factors that involved, like activists who came to the fore to come with a memorandum to submit to the Minister of Health. And those were actually the highlights of the conference. And we had 2,000 people from over 30 countries attending this conference. So it was a great success, and we think there'll be great strides moving forward towards finding solutions for TB.
And when we talk about TB, I mean, a lot of people would say that it is really a stubborn disease. When it comes to dealing with TB, what can we attribute the stubbornness to?
Well, the stubbornness of TB, it's largely, in fact, TB as a challenge is aggravated by factors such as the emergence of drug-resistant strains that make current treatment protocols actually result in many people responding poorly, as you said, because of drug resistance. So there's a need for better drugs to really treat quickly, especially for resistant TB. But another challenge is the co-infection with HIV, particularly people who don't know their status and actually are not on treatment, and as a result, they have immunosuppression. So TB becomes one of the major opportunistic infections. So the major 2 factors clinically would be the co-infection with HIV, as well as drug resistance. But as I said, social determinants where people are crowded in mining, in hostels, and many people in single households. If one person is infected, other people in the households can be infected. So it's not only a clinical disease, but it's a disease that also needs to be addressed by commitment, by better housing, better nutrition, and other factors.
And when it comes to the education surrounding TB, I mean, I remember, growing up and a couple of years ago that, it was always in your face. But now, you barely see adverts talking about TB. When it comes to, how government is addressing TB and TB education, is enough being done?
Well, I would say, well, there are efforts, but I think we need to do more, especially with advocacy and awareness about TB. I mean, it's a historical disease that existed for centuries, but we're still having over 1.5 million people dying annually because of this disease while we have treatment. So I think we need more awareness, we need more advocacy, and we need commitment from government to have better control programs, also to have people screened early enough so that they can actually access treatment early before there's a damage or before they infect more people. So I agree with you, we still have a need for education, we have a need for advocacy and also commitment from multiple stakeholders at community level, with funders, with research, clinicians, policymakers, and government.
And a bit earlier on, Professor, I mean, you touched on the issues around, some of the outcomes from this conference, and quite notable is indeed that open letter you have since written to the health minister in terms of trying to curb TB in South Africa. And, how important is it to prioritize TB and also to push government to a point where, it is something that is highlighted among society?
Well, actually, this is very important. What excited me, in fact, one of my highlights of such a conference, for which I was one of the organizers, is the engagement of society, especially people on the ground, NGOs and activists who actually were a major part of this letter submitted to the minister through the Director General. So that letter actually addressed key points that also include a need for targeted universal testing, indicating that if people are universally screened and tested, as I said again, they'll have access quickly before they infect others and actually have a better outcome, treatment outcome without severe lung damage. And there's also some of the demands, not demands per se, but some of the recommendations to the ministry is the expansion of short course safer TB medication to all clinics in rural area and all spheres of our society. But there's many things that we actually stated with a lot of signatories ranging from multiple stakeholders at community level.
And just dealing lastly again with this conference in which you held, I mean, you know, the notable part being that letter which has since been written to the minister. Maybe just take us through maybe one of the biggest takeaways from you from this conference.
The biggest takeaways for me is the unified tone, because often when there's a submission of a memorandum, us and scientists, other people tend to think it's for others, especially when you have people coming with a silent demonstration. But this time around, I find myself as a scientist in agreement with communities who come to make such demands. And I actually see value, for instance, where I am, to understand the gaps that exist at societal and community level. So it sort of helps me tailor-make my goals on what solutions are required at community level. So I think it actually emphasizes that when you work together with multiple sectors, we are likely to achieve our goals in a unified manner. So my take-home message is actually how everyone worked in good harmony, ranging from communities all the way to policymakers, including scientists as well as clinicians and activists.